it's just the environment growing up. I think people have a lot of mental health issues because it's depressing. Just look around you and to be living in here, it's just depressing, I think. I think a lot of people are coming down with depression, anxiety, stress, just living in these areas.
Depression is a big issue. So it is. I mean, personally, I have family members who suffer from depression. Not as severely as some, but I mean, you go to the doctor, their answer is just to give you a tablet and send you away.
High unemployment levels, high teenage pregnancies, high levels of mental health illness, going back years, poor housing, unemployment, the academic levels, young people leaving school with no qualifications, and not even looking at qualifications, young people still leaving school unable to read and write, and the lack of self-esteem and self-confidence.
I mean, it's the lack of jobs, lack of real interest in the people. You know what I mean? There's all this big thing about, yes, these are the problems and this is what we can do, but they don't get to know the people, and every person's different. You know, 10 people suffering from depression aren't suffering in the same way as the person beside them. So, I mean, there's no real interest in people. You know, take that wee bit more time, because do you know what I mean? You might only be saving an extra one life or spending an extra 20 minutes talking to somebody, but I mean, to that person, that extra 20 minutes can mean more than, you know, 3 days worth of, oh, take tablets, you know, go to this course, go to that course. So, I mean, there is ways around it.
You have to look at the broader determinants, you know, and you know, I've been sort of brought up, you know, both in terms of training and also through experience that you know, health doesn't operate within a vacuum. There's a range of reasons why people live in poor health. You know, if you look at the factors that people are affected by in terms of education, employment, housing, the environment that they live within, the income, you know, there's a range of different factors. So sometimes those things can be generational, and then also sometimes that people's lifestyles, the behaviour and the choices that they make are down to factors associated with the environment that they live within, and also the people that are around them. You know, so it's a whole science really in terms of why people behave the way they do and the factors that affect them. But certainly, North and West Belfast has definitely suffered from years of you know, the troubles and years of underinvestment as well, and that still holds true today, really.
I think government agencies could be more proactive, and the Healthy Living Centres are a channel, they're a tool that they can become more proactive in communities. I actually think they were afraid to come in and work in communities like Ardon and Shankill. You can see a slight improvement in service provision and in proactive from the government, but I think they've an awful lot to address. I think there's a bubble ready to burst, health-wise.
So they should go, instead of asking the people, what way have you helped these children, go to the children and ask, what kind of help did you get? And they'll not be too long telling you, we didn't get any help.